Hello and welcome to the Public Health and Minority Health Disparities Subcommittee. Today we're going to be discussing House Bill 111, which is a piece of legislation brought to us by Delegate Charkoudian. I think we're gonna go to so we have a couple of stakeholders here. I think if it's okay with the sponsor, do you want us to go ahead and have Erin Hopwood, the analyst, describe the amendments that you have? Because I know she prepared them in our packets, or did you want to discuss them yourself?
No, I'm fine either way. They were both recommended by the agencies involved. So
I know you're saying something very smart, but we can't hear you.
Really? I'm unmuted. You can't hear me still?
I can hear.
Oh, wait, it's me. I'm the one.
I can hear Laura.
The one. It is my fault, not your fault.
No worries.
Happy birthday, Delegate Charkoudian.
Thank you.
I will take my own computer off of mute.
No worries. The smart thing that I said was they came from the agencies.
Okay, so we'll go ahead and have Erin explain them. Great.
Yep.
Go ahead, Erin.
Okay, so the bill would require MDH to establish an express lane eligibility program to enroll individuals in Medicaid and CHIP based on eligibility findings by the Supplemental Nutrition Assistance Program. It also requires DHS to enroll in SNAP any individual who meets the financial eligibility requirements established by DHS for a recipient of SSI. It requires the Office of Home Energy Programs to enroll in any fuel and utility assistance program any individual who meets the financial eligibility requirements established by DHS for SNAP, TANF, SSI, or means-tested Veterans Affairs benefits. And the bill also increases the annual income eligibility level for the Electric Universal Service Program to 200% of federal poverty guidelines. There is a reprint in your packet. The reprint, if you look at Bill page 2, these were the amendments suggested by MDH and are being sponsored by Delegate Charkoudian. The amendments clarify that MDH can apply for one or more waivers to implement the program, and also allows the department to implement express lane eligibility for renewals before using it for initial enrollment. And then you had a separate amendment, I believe this was requested by DHS, and that just clarifies that the enrollment in the fuel and utility assistance programs is for households of the individual.
Excellent. Okay. I'm going to turn this over. We just had the hearing on this bill, but I would like to give Delegate Charkoudian an opportunity to talk to the committee, and then we can discuss the amendments and the bill. You know, we have a little bit of time, so we might as well take time to discuss it. Delegate Charkoudian, what do you have to say to us?
Well, thank you so much. Yeah, so as a reminder, you all have been doing a ton of work, by the way, first with bills on the floor. Congratulations. So as a reminder, since you've had so many bills, this is the bill that just streamlines the application process. So we essentially have the same set of requirements and the same set of documents and all the things that have to be uploaded and filled out for Medicaid and for SNAP and SSI and for the energy assistance programs. And yet people have to do it 3 different times. And so it's inefficient for the people who have to complete those forms 3 different times. They're more likely to either not get the service that they're eligible for, or not get renewed in the service that they're eligible for. And it's also very inefficient for state government because you have 3 different agencies all looking at the same sets of documents to determine eligibility. So the express lane eligibility process within Medicaid allows for folks who have the SNAP to automatically be enrolled in Medicaid. And then the adjustments we're making to OHEP allow for the automatic enrollment in the energy assistance. And that's really what it comes down to. And the only other thing I would say in addition is that because more people have SNAP than Medicaid, and I see Vinny's on here, which is great. He probably has the numbers off the top of his head. We expect that this would really make a significant dent in, we're at 6% uninsured. And I know you all are chipping away at all the various places where that 6% comes from, but we expect that this would make a significant dent in insuring tens of thousands more people and really getting us closer to that 0% uninsured goal that we have.
Excellent. And do you have comments on the DHS and MDH amendments that we have?
Oh, thanks. Yeah, no, those were technical amendments from the departments and they're totally fine. Yeah, thank you.
Excellent. So if it's okay with the committee, before we discuss the bill as a whole, I know there's a lot to discuss. I'm not blind to the fiscal note. Do you guys want to go ahead and adopt the technical amendments so we can discuss the bill Is
Move
that
to
okay?
adopt the technical amendments.
Second. Moved in second. Any discussion on the technical amendments from the agencies? All in favor, say aye. Aye. Anyone who's opposed, raise your hand in the chat. Don't see any problems with that. Perfect. So with that, let's discuss the bill. We have Delegate Rosenberg followed by Delegate Chisholm. Delegate Rosenberg.
Would this process of applying be similar to what we already do in law with regard to voter registration and perhaps even other things? Question for the sponsor, if that's okay.
Yes, Madam Chair, is that all right if I don't know what
Absolutely.
your protocol is?
We're
Yeah,
here to pick your brain on the bill and also the advocates. So we see Vinny smiling there too.
yes, it is sort of a, it is very similar in that you check this box here and you're in that system there.
But you said very similar, just to be clear.
Well, the difference is that, I mean, in the case of voter registration and getting your license, it's a much more streamlined process. In this case, you're uploading multiple documents. It's just these processes are very complex, difficult processes that often people need navigators to help them through. People fail at it the first, or aren't able to get through it the first time. So if you think about a voter registration with a DMV license, it's a relatively simple process. I'm just saying this involves uploading social security cards for everybody in your household and upload. So that's why I'm saying, yes, similar in the streamlining of it, but very different in the actual process that one goes through to access these services.
Okay, that's fine by me. Thank you.
Absolutely. Delegate Chisholm.
Thank you, Madam Chair. I think the other big difference is it's free to vote. I don't think that there's a whole lot of correlation between these two things, with all due respect. But one of the things that struck me about the budget in Kerwin was it was showing that because of all of the students now being added to free and reduced meals, it's going to bring about a deficit of $1.6 billion. Now, SNAP pays 96% of that, but there's other services that are required when we start to have everybody. We have 50% of our students on free and reduced meals. And the reason I bring that up, and then today, obviously, you guys probably know if you've read anything at all, that there's a huge problem with SNAP right now, and there's a lot of fraud and abuse in SNAP. And so my concern is, does this lead to even greater fraud and abuse across all of these programs? And my wife's aunt has lived with us for like 8 to 10 years. She got Down syndrome, but she has all these different programs involved with what she does. And they are very careful, like when she works at OBI, to make sure she doesn't make too much money. Are you concerned that if you automatically enroll some of these people into different programs, you are going to disqualify them for certain programs, and they may be getting enrolled into programs that they don't even wish to be enrolled in? I appreciate trying to streamline a process where people really want to be in the program. I just think that there's a lot of pitfalls in automatically enrolling people into programs that they may not even know that they're enrolled in.
So I'm going to direct that to the sponsor, but I don't know if you want to also include Mr. DeMarco in this answer, because I know it's a compound question, but I'll give it to you first.
I do. Thank you. And I thank you, Madam Chair. And thanks for the question, Delegate. And Vinny, I'm going to give you the second bite at this apple as soon as I give it my best shot. So the first question was about SNAP fraud. And it is my understanding that the SNAP fraud is not related to enrollment, but it's actually theft off of people's SNAP benefits. And so while that is a tragedy and needs to be addressed, and I know that we have bills that are working on that in this legislative session, that wouldn't change this, because it's not that people are enrolling in SNAP fraudulently, it's that their money off of their SNAP cards are being stolen. So that this piece of now they have SNAP, now they get Medicaid, the two issues don't interact, except that the same people who might be harmed in that fraudulent might benefit from being in Medicaid. So I don't think that that's an issue on this bill. The second issue was, what if people don't want to be enrolled? And so the way that it works is the concept of enrollment is that you have completed all of your eligibility and you now are in. People can be informed and they can choose not to have that service if they choose to not have that service. But the term is, and we actually spent some time, and this is where I'm going to ask me to talk more. The term is, in fact, enrollment, because that is what it means to have established the eligibility for someone to not then have to go through an additional process. And I think I'll pass it to Vinny and take up if there's anything else after he's done.
Thank you. Let me start and then maybe ask Tricia to help also with this. No one knows for sure, but we estimate that there are about 60,000 people on SNAP who are also eligible for Medicaid but not enrolled in it. And the question is, why is that? And everybody needs food right away, and no one knows, am I going to get sick? Am I going to need health care? And in addition, you heard testified for your committee, Steve Robbie from Opinion Works, very prominent pollster and researcher, who conducted a focus group at our request of people who are eligible for free healthcare and not enrolled, and really dig down into why. And there were two basic answers. One is people just don't know. I mean, much as we think it's counter to it, people just don't know. So we want to make sure they're enrolled. And the second, it is there are burdens that people have of especially lower income people in going through the administrative process, especially if you've already done it once for SNAP. So we think it's very, very important that those 60,000 people get enrolled right away. And as far as the process of being able to say no, I'm assuming no one is forced into it if they don't want to be on Medicaid at any point. And maybe I'll turn it over to Tricia if she wants to add something.
Yeah,
on that.
let's hear from Tricia on the details of how Medicaid works and would work with this, and anything else you want to add right now.
No, I think Vinny did a nice job. The only thing I think I'll add, just to remind folks, is on Medicaid, you are allowed to have other insurance, and we're supposed to and required to coordinate benefits, and we are supposed to be the payer of last resort. So there are many low-income working families that have commercial insurance from Care First and others. And again, the basic premise of Medicaid is that we should not be the primary payer for those covered services. We should be the secondary payer and never pay a bill when there's a commercial policy in place.
Thank you for
Chair,
that. You can have a follow-up. Yeah, go ahead. And then we'll go to Bagnell, Delegate Bagnell, Delegate Hill, Delegate Lewis. Go ahead, Delegate
since
Chisholm.
we're in subcommittee.
Yep.
So look, I appreciate not wanting to be duplicative with the process of enrolling in different programs. My concern is I might be wrong about this, but there's a lot of people that are automatically enrolled in SNAP, which then would create this chain reaction where they're getting enrolled in other things. And then we saw what happened with unemployment insurance, and people, when you say that the SNAP program had people taking their benefits or their money and ripping off, that meant that they had access to their personal information. So now we're opening up personal information across many different agencies. And I know we do a great job of trying to prevent this fraud, but we had 80-some% of the unemployment insurance we found to be fraudulent. My concern is that we are just opening a Pandora's box for more fraud and abuse, and finally having people enrolled in something that had no idea that they wanted to be enrolled in. If you wanted to do it in a way, it would be at least much more acceptable to me if you said, all right, you already provided these here to SNAP, you don't have to provide them to Medicaid, but here's your option, just add this, rather than saying, all right, you're automatically enrolled all the way across the board. Just my question of how are you going to stop some of the fraud and abuse?
Can I ask some clarification on what you're saying right now? So just add this, meaning, affirm that you would like to be enrolled, or supplement with extra documentation. What are you suggesting specifically?
Extra documentation or an opt-in. I understand that you don't want to put your Social Security card in 3 different applications or whatever you're doing, but make it so that, all right, you've already done this. All you need to do now is add whatever you might need to add, just to create this authentication that can be corroborated with others. And you're not really duplicating everything. You're just opting into the different programs to which you really want to opt into, without going through all the bureaucratic red tape that many people feel when they're filing for government programs.
Okay, so in the questions I have in order, Delegates Bagnall, Delegate Hill, Delegate Lewis, Delegate Hutchinson, I want to give Vinny a chance to succinctly, if possible, respond to Delegate Chisholm's concern about fraud or abuse. And you can talk to me about if there's guardrails in this legislation, and do you have any kind of answer to that?
Well, I am no expert on the fraud and abuse piece. I defer to Delegate Charkoudian, who described that SNAP fraud is people taking advantage of people on SNAP. As far as for Medicaid, we believe it's important that there be automatic enrollment at this stage, and also we're also asking for that at easy enrollment. You passed a bill in 2019 creating an easy enrollment tax form with auto enrollment there, which hasn't been in place yet. New Comptroller Brooke Learman says she's going to work hard to make that happen. We think that it's very important that people get auto enrolled if they're eligible, with the ability to say no if they don't want to stay, to make sure that as many people as possible are in the Medicaid rolls who are eligible in the state.
So maybe Trisha, do you, I know we don't have anyone from SNAP here. We can bring someone next week to answer questions specifically about what guardrails exist. Can you tell us about what guardrails exist? If we were to adopt this, how you would be confident that there wasn't the type of fraud that we saw with the unemployment insurance, which again, I can confirm what Delegate Charkoudian said, that the article I read about SNAP was really folks stealing benefits that were entitled, not people earning benefits or claiming benefits that they were not entitled to. But Trisha?
Yeah, I mean, I think it'd be good to have folks from DHS. I don't think SNAP, I don't think there's an automatic enrollment happening right now. And then secondly, the amendments are allow us to phase in, do two components of what we're talking about here. The first phase will be focused on people who are already on Medicaid and they're coming up for a renewal application. So we've already completed their application once. We are looking at SNAP to automatically complete their renewal application. And the goal will be to get permission to automatically renew the full family. And then the second ask for the federal government will be on new people that aren't currently enrolled in Medicaid. I will say, they will be active in that decision-making process because they will have to select a managed care organization. They will have to select a primary care provider. So it's not like there is no point in which they will be contacted as they get enrolled in a managed care organization. And at each point that they're contacted, they will know what is being provided to them.
Great. Thank you for that clarification.
Madam Chair,
go ahead.
As the chair of the Unemployment Insurance Subcommittee, I just wanted to clarify something there as well, which is 87% that's way higher than I believe what the fraud actually was. But the more important thing is that the number of documents and the way that one applies for unemployment insurance is very different than the way that one applies for SNAP and all of these benefits. And so the ability to engage in fraud in unemployment insurance is just different for a whole host of reasons, and that we just have not. And even in the pandemic with higher SNAP benefits and everything else, we don't see that kind of fraud in enrollment in SNAP. It's just not a problem. And there's not a reason to believe that it would start being a problem because we streamlined these other processes.
Excellent. Thank you for that clarification. And Delegate Chisholm, we will make sure we can get someone from DHS here next week to further give us information about that. Is that good for you?
Madam Chair.
Okay, so we'll move on to Delegate Bagnall, then Delegate Hill. Delegate Bagnall, thank you for your patience.
Thank you, Madam Chair. And this is just a clarifying question. The bill doesn't change eligibility in any way. It just determines across multiple programs your eligibility. Is that correct?
Can I answer that question? For Medicaid, that is correct. I'm hesitating because for energy assistant, that's not correct, but I'm told that I was asked to separate out the, I think that you all are not going to be addressing, I don't know if I'm jumping ahead of the game or what, but I think you're not
the beans.
I don't think you're going to be addressing the energy assistance part of it. So it is actually changing, and all the money in the fiscal note is related to changing the eligibility for energy assistance. And there is a funding source for that if folks were interested, I'm happy to talk about. It's a special fund. So it doesn't change the eligibility for SNAP. It doesn't change the eligibility for Medicaid. It just streamlines those. It does change the eligibility for energy assistance, but I don't think you all are going to be ultimately making that decision.
Got it. Thank you. Thank you for the clarification.
Absolutely. Next is Delegate Hill.
Yes, thank you. Lord, I like the automatic for Medicaid. I love what that's doing. I like the SNAP. I guess what I'm wondering is I'm thinking about some of Delegate Chisholm's points, and I don't think that either of these programs would count as additional income that would disqualify somebody who has a ceiling on their income. But I am a little bit concerned that as this program is designed, that it definitely makes sure that the customers, the constituents are notified and have an option. And I'm wondering if you think it's redundant or whether there might be an actual benefit in our fashioning some language in here that essentially says in designing such a program, the department shall ensure that enrollees are notified and have an option to decline or something like that.
May I answer that?
Yep, by all means.
I think that Tricia's comments to some extent answer that, because after you're told you have been enrolled, you have to take steps to actually have it mean anything, right? The same is true for energy assistance, which we're not talking about, but you still have to take a step and say, this is my BG&E account number. So if somebody got enrolled and didn't take an affirmative step, that for all intents and purposes, they wouldn't have anything, right? So I think it's redundant, but I don't oppose it. Like if you all decided that's what you all wanted to do, I don't think it's necessary, but I don't oppose the concept of it.
But
Right,
if
thank
committee
you.
members felt they needed some reassurance, we could come up with some language. Excellent. Delegate Lewis.
Thank you, Madam Chair, and thanks to the birthday sponsor of the bill. I also wanted to touch on Delegate Chisholm's question regarding impacts on income. And I think it might be helpful just to get clarification. This would be a question for DHS, perhaps. But to
Looks like we got someone from DHS, Katie Peterson here. Thank you for joining us.
Hooray, hooray. See, ask and you shall receive. So may I proceed with my question then, Madam Chair?
Please.
That's perfect. Yes, thank you. So the question for DHS is just to clarify whether or not SNAP benefits are treated as income, because I think that was at the heart of Delegate Chisholm's question about potential impact of enrollment on a recipient. That would be my first question, and I hope that can be answered.
Katie, do you know the answer to that?
So I'm going to have to follow up on that, but I did want to mention something that you kind of have looped around. And so a similar bill is being heard today at 1, and it is, let me pull up the number, House Bill 323. And we had submitted a letter regarding that bill as well. And there was a piece in this current bill that we had not addressed in our letter, and it was regarding on page 2, lines, hold up. It's about the Social Security. So that is one concern that we do have, because just because they qualify for Social Security income, that's based off an individual piece, whereas SNAP is based off the household. So that would work for individuals that are in a single household, but it would not work for individuals that qualify for SSI, but their household is not included in that eligibility, but the household has to be included in the eligibility for the SNAP benefit.
So is that different from the amendment we adopted at the top, or that is the amendment we adopted at the top?
Correct. So you adopted my understanding was that you adopted one amendment about the household piece.
Correct.
Yep, at the top, but then there's also on page 3, line 20 through 23.
I don't know what that is.
That piece is about the individual that is eligible for SSI, but SNAP has to consider the whole household.
So we would need a clarifying amendment there as well.
Or to have that piece removed. So in the letter we submitted for 323 that's being heard today, we suggested removing that piece because it would work for the single individual household, but not for anybody that has more than one person in the household.
Okay, we will put a pin in this since we're coming back to this bill next week, and I'll give the sponsor some time to digest that unless do you know the answer to that now, Delegate Charkoudian, what she's talking about? Are you okay with that? Does that
I
make
do, and this is the bill is actually being heard on Thursday, not today, but yeah,
That's not for this bill then? I'm sorry.
no, it is.
Yeah,
She was
it's
talking
for
about a
both.
totally another bill.
Right,
No.
okay.
It's in this bill also.
Yeah.
But it's the section that we're separating out. The other bill that she's talking about, which has redundancy, it has the redundancy because it's related to the energy assistance.
Got it. Okay, that makes
And
perfect sense. So if we're not
that's
taking
being
up
heard
the
on
energy
Thursday and-
part, we may not need to make this correction. So we
Correct.
will pick this up next week, but I will also ask you, if possible, to come back next week with some more answers to these questions that we're having about how SNAP works and if it counts as income and what the rates of potential fraud are. Is that something you can help us with?
Sure, yep, I can bring that
Awesome.
information back.
Thank you so
Can I
much.
ask I'm sorry, Madam Chair, but since we have Katie on, I wanted to ask if we could find something else. I can email her separately if.
No,
if
no,
wish.
Delegate Lewis is not done with her question yet, but go ahead and say the specific thing because I know she's coming back and we had a long conversation. Go ahead, Delegate Chisholm, and then we'll go back to Delegate Lewis.
Obviously, there's a lot of students that are automatically enrolled in free and reduced meals, which SNAP pays for. So if SNAP is got those individual students, once they become adults, do they have to re-enroll for SNAP at that point, or is SNAP actually have every individual that's on free and reduced meals that they're funding in a database that then moves on with them? I'll do some research too, because it's a little bit, but that's what I'm trying to find out is, does SNAP stay with them?
Okay, so we'll try to get to the bottom of that next week. And then I'll go back to Delegate Lewis because
Chair?
you had the second part to a question. Delegate Charkoudian, yeah, do you know?
So
the
I
answer?
just would remind everyone that you have to re-enroll, you have to reapply and re-enroll every year for all the benefits. So I don't, Katie can tell me if I'm.
I was just going to say, because your household composition could change.
So nothing stays with you unless you re-enroll. And that's part of what this bill is doing, because some people start with all the benefits, but then in re-enrollment, they re-enroll one thing, but they don't, and they lose the other things. So
That's
nothing
very-
stays with you without a once-a-year check-in to see what your eligibility is.
Okay, and then the re-enrollment on the Medicaid side is the first thing we're phasing in, right, Tricia? That's what I'm hearing from you is the plan.
Right, exactly. So we'll rely on the SNAP process for eligibility, and we'll use that for re-enrollment purposes.
Excellent, thank you. Back to Delegate Lewis for the second part of your question.
Thank you, Madam Chair. I think it would be very helpful if DHS and Medicaid could provide an overview of eligibility and enrollment for these two programs. There seems to be confusion and conflation of concepts. There's concern about a database with everyone's name in it and privacy and opportunities for fraud at the point of enrollment when eligibility is determined. There's some confusion about what the different eligibility standards are for these programs. I think an overview would be helpful, and perhaps that could be prepared in the form of a little summary with some bullets or a matrix comparing eligibility standards, documentation required for application, etc. Because I believe once the confusion is addressed, some of our questions will be answered. Thank you.
I think that's a really wonderful idea. Erin, do you think you can work with stakeholders to make sure we can get something like that for next week?
Yes.
Excellent. Thank you. Now I see Delegate Hutchinson's hand is down. So has your question been already answered? Okay, then let's move on to Delegate Rosenberg.
Thank you, Madam Chair. If I heard correctly, I think it was Delegate Charkoudian who said there are other steps in SNAP where people have to take action to be enrolled, and a fair number do not. Did I hear correctly? If so, what are those steps? And is that something that should be addressed in this bill?
Sorry, you heard, I think, pieces of what I intended to say. So if I can clarify, Madam Chair, I think what I was saying is, so what the bill essentially starts with SNAP. So we're assuming that people are seeking SNAP and are applying for SNAP, and there's the multiple steps and all the documents that get uploaded. And presumably when they're done with that and they're determined eligible for SNAP and they get their EBT card, that's what they intended. Now, when if the bill passes and they are automatically enrolled in Medicaid, they can't they're not really enrolled, or they're not actually users of Medicaid at that point, because they have to select providers, primary care physicians, et cetera. Or, well, I won't talk about energy assistance because we're not gonna do that. So when I'm saying that there's subsequently an active step to basically really be enrolled, or be enrolled in a way that's meaningful and that you're able to use, that's what I meant. So in theory, if you had somebody who really didn't want Medicaid, and they were automatically enrolled, first of all, they can unenroll, right? They can choose not to have it. But also the proactive step of saying yes is the step of selecting all these other things that they need to select.
And then that is not something we can speak to in this, or should speak to in this bill.
Well, I guess Tricia could jump in, but it's my understanding that you have to do those things to be able to use your Medicaid services. And so, Tricia, did you want to?
Yeah, I'm happy to jump in. The premise in Medicaid is that individuals should always have a choice. So we shouldn't be messing with that, because the federal government wouldn't allow us to mandate, that they don't have a process in which they have an opportunity to choose. Okay. And just separately, I mean, so I want to go back to Delegate Lewis's comment. I mean, individuals do have to enroll in our programs. And so there is a database, right? We have a whole eligibility system. We're required to keep names and addresses and everything that we're paying for services on Medicaid, and similarly with SNAP. So there are current databases with people's names that are receiving services under these programs. So I just want to make sure that that exists today. That's not something that's going to be new to this.
So we have Delegate Hill and Delegate Riley, but I'm going to butt in front of them because I think it's appropriate, as with what Tricia was saying. The question I had to, and I apologize to my colleagues, please forgive me, but the question I think will help inform the discussion. Tricia, I heard Vinny say when he was talking that there are 60,000 people on SNAP who are Medicaid eligible but not enrolled. So if we were to pass this bill with the amendments we adopted today, and then other amendments about the energy assistance, removing that component, can you just tell the subcommittee from a Medicaid perspective what you think is going to happen, what that timeline would be, and if we would make some inroads with these 60,000 people?
So I think, generally, well, two things, and I'm not going to disagree with Vinny's number, but I will a little. I think we are working through DHS, and we're trying to get a data use agreement in place so that we can actually understand how big that number is and the potential of how many families and children will be impacted by this. Again, because we're staging this in two parts and focusing on the renewals, the initial impact will be smaller than what the second phase it will look like. So I definitely think there's obviously going to be a positive benefit in terms of enrollment. It will be smaller initially, and we are trying to better refine that number.
Great. Thank you for that clarification. I appreciate it. Delegate Hill, then Delegate Riley. Delegate Hill.
Yeah, thank you, Madam Chair. Tricia, this is for you. Delegate Charkoudian was mentioning a few minutes ago that after the auto enrollment, there are affirmative steps that someone would have to take to actually receive benefits. So they're enrolled, but they're not going to receive until they take affirmative steps. And then she said, and of course, they could always de-enroll. So can you explain for these programs, particularly for what is involved in de-enrolling? So because we're going to pull people in and go ahead. Can you just explain what's involved with de-enrolling?
Well, so I want to be clear too. There is opportunities along the process where they select an MCO and they select a primary care provider. We do, if there is no action from the individual, we do automatically assign them to both an MCO and a PCP. But the point is that there's contact with the individual where there is further communication on what's happening with their healthcare benefits. So it's just not an automatic enrollment at the initial standpoint.
It's not an automatic enrollment, or it's not, in other words, you have to name your PCP to be assigned and to make an appointment. But if
you get automatically enrolled in Medicaid, you'll say you have, so many days to select an MCO.
And if you do not, what will happen?
You'll be automatically enrolled in an MCO. The MCO will then reach out and say, please pick a primary care provider. I forget the time frame in which they are allowed, able to pick a PCP. If they do not select a PCP, one is assigned to them.
Correct.
On that piece. Now, at any point in time, an individual can call the exchange and online and say, I would like to be disenrolled for these reasons. And they can activate that. And that's their right to do.
Yeah. So, and I think that process, I've called the department and had difficulty getting my phone numbers answered. I find difficulty even finding phone numbers on there and working on the web. So, Madam Chair, I would like to ask you to definitely move ahead with what I had previously suggested and ask Erin if maybe she can work on some language that we could amend on to say that the department would need to come up with clearer ways for people to decline when enrolled, that they'd be notified and they have a clear way to decline if they don't want to participate, as opposed to we didn't hear from you and we keep moving you on until you call us up. Thank you. So
that the proposal would be that we would potentially move forward with this auto enrollment, but ensure that there is a no thanks option at some point in the process. That's clean and deliberate, that the person, other than, doesn't have to go through a whole lot of hoops, or it's not on them to figure out how to notify or get online to reach somebody and hope an email is it. Yeah. Thank you. Tricia, did you have your hand up? Did you want to respond? And then
I did. I'm throwing this out there as a way to kind of think about it, is that maybe the opportunity for that to happen is when they're enrolling in SNAP, right? Because then you're already filling out paperwork, and maybe there's a notice that if you do qualify, we would automatically enroll you in Medicaid. If you don't, we could think through that process. But
I think there are ways to do it. Certainly when we did the tax auto enrollment, we ended up with language that said, do you want to be, right? If you want us to enroll you for programs you're eligible for, let us know and you will be contacted. But we had to put that in there. And I think something like that would be for all of these programs, because we don't want to make life harder on people.
Yeah, but I do agree with Tricia that you would want to start at the starting point, which would be
Absolutely,
application.
absolutely.
Delegate Riley, then Delegate Hutchinson. Delegate Riley, thank you for your patience. You're up.
Thank you, Madam Chair. Yeah, I got a lot going on here. And it's between health and income and so on and so forth, and back to the, the fraud and abuse. So a couple questions. First of all, just say this bill passes, okay? And we move forward and we automatically enroll those folks that are currently on SNAP into Medicaid and so forth. So I hear everybody saying that that's an automatic process. So once that process is done, they pick their, their PCP and all that, and they're actually enrolled and everything. Do they have to go through a renewal process each year, or is that gone with this bill? Or do they have to meet it like every couple of years? Or is it just automatic?
The renewal processes are every year for all these programs. And so the renewal, so you have to complete the application process for a program. So right now, if you complete it for SNAP, you would automatically have completed it for Medicaid if we pass this bill.
Right. So
there's
going
still a need to
forward,
establish.
it'll just be one. So going forward, once they're in the system, instead of having to fill out, 3 applications or what have you to be enrolled and renewed, they just have to do one renewal.
Correct, but they're still doing all the same income eligibility verification, household, all that same stuff.
Okay.
Annually as they're doing now or would have to do now, except instead of right now, they're doing it twice. In this case, they would do it once.
Okay.
Another way of thinking of it is that we're not only making it easier for people who are eligible for benefits the first time, but every year subsequently.
Correct.
It compounds the positive impact for people. Okay, Delegate Riley.
And okay, so I have like 3. So the next question would be specifically with the SNAP, okay, and reference to income and so forth. So with the SNAP program, do we have a percentage of people once they're on SNAP that we're trying to get them off of it? Is that happening in the state of Maryland, or we just keep increasing and increasing and increasing? And if that's the case, why? Shouldn't we figure out why all these folks are on SNAP and what we can do to help them get off? Or
Is
are
that
we
a question
encouraging them?
for Katie? Did you want
Yeah.
DHS? Do you want to come back with that information too?
Yeah, I was just thinking the more questions that are asked, I really love the idea of having us come do an overview of SNAP and really just provide some data and research and information. I think that would be really helpful.
Excellent. So we will answer that question for you, Delegate Riley, next week in a big picture conversation about how SNAP works.
Okay, and
Next
then
question.
my third and last question, I promise, I shouldn't promise. Is, you mentioned the fiscal note, it's huge, 30 million. So if we take the energy portion out, you kind of like alluded to that's what's going to happen. So taking the energy portion out of that, does that mean we're going to get an amendment that portion is coming out and it's going to reduce the fiscal note?
Yeah, I think that the discussion that is ongoing is the possibility of taking out all of that, which would I don't know if it would completely eliminate the fiscal note, but certainly the vast majority of it. Delegate Charkoudian?
Yeah, the 20,000, 30, I'm sorry, the 20 million, 30 million, all of that I know is the energy assistance. I'd have to look to see if the 72,000 and 144,000, if that's Department of Health or Department of DHS. I don't know if there's someone on here who knows, but yeah, all the 30 million numbers are all from energy assistance. And just so folks know, because you'll ask about it on the floor, otherwise it's that comes from Reggie money, and the Reggie money has skyrocketed in recent years. And when we discuss this in ECM, we'll have the Reggie numbers in front of us. So it's not like it's a special fund, and it's Reggie, and it's 50% of all of our Reggie income goes towards this. So it's actually a very, over the next 5 or 6 years, we expect it to be a very easy number to reach. And in fact, we may have extra money we'll have to figure out what to do with.
But for now, for this subcommittee's purposes, we don't have to worry
Yes.
about that part.
Correct.
What we would do process-wise, Delegate Riley, is adopt an amendment, and then we would get some information about what the updated fiscal impact is. I know that's of concern, so we would get some clarification on how many, if it's tens of thousands left or not, what that looks like.
Okay, thank you very much. The sponsor of the bill, Delegate Charkoudian, and also Chair. Thank you.
Delegate Hutchinson.
Thank you, Madam Chair. This question is actually for Tricia. It's sort of a process question around how one goes about to unenroll in Medicaid. So if I am enrolled in Medicaid and then I'm assigned to an MCO, am I canceling through the MCO or am I canceling to the healthcare exchange or to the state level? Who gets notified? How does the individual notify they want to get unenrolled?
So you would call the exchange essentially and contact their call centers and start that process. It wouldn't be through the MCO. I think you probably could notify them but it would have to be activated at the exchange level.
So let me just, the reason I asked that question, let me share with you something happened to a constituent of mine where it wasn't through Medicaid, but they were on the exchange. They want to cancel their policy. They normally go to the back of their card and they contact Care First. They cancel their plan and come to find out the next month that no, you had to go through the exchange and they've been billed for a whole nother month of care. So I just find that there's a issue there that could be costly to the state with them not knowing who to go to.
So we can absolutely clarify that, but there's reasons why you don't want the insurance companies being the people who are automatically enrolling folks right into plans. And so it has to be at the exchange level.
Okay, I see this conversation going further. I see Delegate Hill and Delegate Lewis with their hands up, but I also see that it's 11:49 and I see Deborah Mercado has been waiting patiently. So let me check with her and see if she has something to add to this conversation before I go back to Delegate Hill and Delegate Lewis, since we have a hard stop at 12. Ms. Mercado, did you want to weigh in on this bill?
Yes, I'm Deborah Mercado from Maryland Right to Life. And yes, we are concerned about additional funding for abortion and abortion services being created by this bill. Naturally, if the goal of this bill is to increase enrollment in Medicaid and other services, it would also mean that there would be more funding for abortion. So we would like to see an amendment that excludes any abortion funding in this bill.
Okay. Any questions for Ms. Mercado on that particular amendment? I would ask Tricia, this isn't actually all we're doing. We're not changing the Medicaid program in any way with this bill, right?
No, we're not. We're just folks that should be enrolled in Medicaid. We're just making it easier for them to enroll.
Okay, thank you for that clarification. Any other questions for Ms. Mercado before I go back to Delegate Hill on the larger Medicaid conversation? Okay, thank you for joining us. We hear you and thank you for being here. Delegate Hill.
Thank you. Delegate Charkoudian, I'm just wondering, and maybe I'm going back and this was explained in the beginning, but this automatic lane, why is this the better approach than saying, let's come up with a uniform application process or a uniform application where each of these programs, by filling out a single application, the person will be eligible for? Why are we coming up with express lanes and just saying, you fill out one application and if you qualify for any of these 3 programs, any of these 4 programs, the information will be used and you'll be enrolled. Tricia, I guess she was getting ready to answer that. Yeah.
I think the easiest is because it's required from the federal government. It's sort of what they require us to do.
Okay.
Good answer. Are you good, Delegate Hill? Delegate Lewis.
Thank you, Madam Chair. I just wanted to try to answer Delegate Hutchison's question. And I wanted to offer, first I want to make a suggestion that when it comes to constituent services about health insurance, there's a lot to know and new members might not have that information. So, perhaps a briefing or an overview or a fact sheet about how to answer constituents' insurance questions could be helpful. I also wanted to offer myself as a potential resource. I field a lot of constituent insurance questions and I worked at the health exchange. I'm happy to help you help others. Thanks, Madam Chair.
I love the spirit of community. Thank you, Delegate Lewis. I don't see any more hands up right now, which is the most exciting thing that's happened because it's only 11:52. Is there anybody else who has something they want to add? Delegate Hutchinson, go for it.
Just in the spirit of openness and transparency, I was the constituent that I was referring to.
Thank you. Well, get together with Delegate Lewis. She'll hook you up with some information. Delegate Chisholm.
A quick question, because it was just brought up by Tricia, was we do applications a certain way because it's what the federal government requires. But if we pass the bill, are we going to run awry of those requirements with the applications?
Very
With
good
saying we
question.
only have one application.
So,
Yeah.
Tricia.
No, the express lane eligibility is the federal term that allows us to do this. You have to get special permission, but we wouldn't do anything without them approving first. But there is the path forward, and that's why it's called express lane eligibility.
Thank you.
Excellent. Katie, something to add?
Just to note, besides the one piece about the Social Security, then having them qualify for SNAP because of the household piece.
And again, that they allow that there's special rules with how you count the income from the federal government. So we wouldn't do anything that isn't in line with their approval.
Thank you. Okay, so I'm going to do my best summary, but I might depend on Aaron, who I know has been taking copious notes. We're going to come back to this next week. Somebody will be here. It may not be me, but we will be back next week to discuss this bill. And in that conversation, we will have an overview of how SNAP works and answer the many SNAP related questions that came up in this discussion. And we may also have some language to run by the folks at SNAP about making sure that we can opt out of this, or some rough approximation of choosing not to participate, per Delegate Hill's suggestion. Is there anything else that we want to make sure we come prepared with next week from the members?
Ma'am?
Yes.
Thank you, Madam Chair. I think if it's at all possible, it could be helpful to hear from DHS whether or not this bill would help the state of Maryland avert the disaster of people being thrown off Medicaid when the public health emergency funding ends, and what is the magnitude of disaster we could avert by passing this bill. How many people would be helped? That would be, if you could confirm that 60,000 number, would be helpful. Thank you.
I see a thumbs up from Vinny, so hopefully he's going to bring us some more information also next week. Anything else we would like next week from the people working hard on this bill? Okay. Wonderful. Well, we will reconvene on this bill next week, and thank you very much to the sponsor for answering our many questions on her birthday, and for bringing us this legislation to discuss. Yay. Happy birthday. And with that, we're going to conclude the Public Health and Minority Health Disparities Subcommittee meeting for today, and we will meet again next